Well, welcome. I'm Brian Lutzy. I'm the Superintendent of Schools here in New Canaan. Thank you for joining us this afternoon for approximately an hour-long session to provide a high-level overview of our reopening guide and then to open up for question and answer period. We hope for this to be an interactive session. So why don't we just take a moment, go around, just introduce ourselves, and then I'll dive right into our protocol and the overview. And I'll ask our Deputy Superintendent, Dr. Correnti, to begin.
Hi, I'm Jill Correnti, Deputy Superintendent of New Canaan Public Schools.
Good afternoon. I'm Darlene Pianka, the Director of Human Resources for New Canaan Public Schools.
Good afternoon. I'm Bill Tesber, Assistant Superintendent for Pupil Services.
And I'm Jan Murphy, Principal here at West School. Hi, everyone.
Hi, everybody. I'm Ashley Fernari, the Assistant Principal at West School.
And our board members as well. Julie?
I'm Julie Reeves, Board of Ed member.
I'm Deanna Carlson, Board of Ed member.
Great. And thank you all for joining us this afternoon. Again, we hope for this to be an interactive session, but thought it would be most helpful for us to begin with an overview of the COVID operations plan and guide that was published late last week. I hope and expect that we have parents of our incoming kindergartners right up through third grade and maybe even preschool parents. So the way the webinar feature works, you can use the question and answer button. There's a Q&A down below and feel free to type in your questions right into there as we go. Dr. Correnti and others will be sort of curating those questions, trying to put them together for our Q&A that'll come after the brief overview. As you know, our district has been hard at work since the moment we closed to try and figure out how best to bring our kids back, get our schools fully open. I said this last night with the governor on the call that nobody wants kids back in schools more than the educators. You know, we've dedicated our lives to doing this work with our kids. And, you know, we know that we're in a period of transition now, a period of flux as the world and the country and our state wrestles with the pandemic. But we want you to know that we are working on this daily. We are single-mindedly focused on making sure that whatever we do it with the health and safety of our students, our staff, and the community first and foremost in our thinking. So why don't I share this screen just for some, let's see, visual here. Okay, how's that look?
Great.
Great, thank you. And for our audience and folks that are dialing in, understand that, you know, we've been using Zoom regularly since March. That doesn't make you an expert. It just means you use Zoom regularly and sit in your chair a lot for meetings. So we will do our best to make this as kind of smooth and comfortable for you as we possibly can. But again, thanks for putting some time aside. We want to make it worthwhile for you. So we published our COVID operations guide. And just to begin, you know, the focus has been really on what are our schools going to look like on day one? How are we going to open? And that's an important focus and an important question. But it's not more important than what are schools going to look like on the 5th day or the 10th day or the 20th day or the 30th day. You know, this is we're in an environment where we have to think short and long term simultaneously. We have to make sure that we are nimble in our decision making and that everything we do is fact based. So I want you to know that while there's a lot of focus external to our district around what's day one going to look like, we are really maintaining our focus on what is the year going to look like. And we believe that by really working hard and developing that and figuring that all out in advance and along the way as new information comes, we can create something that is different, but it's new and it's unique, and it will be uniquely our students and our staff and our schools in what they have. You know, we're going to hold on to all of the great things that we're known for and that we do and all the ways that we can, but we're also, where we have to figure out new ways of doing things, we're open to that and we're working to figure that out. Because our goal is to provide a world-class education to every one of our kids. That's always been our goal. That's what we're working to do. And you see, we break that out in different ways and different times, but that's our focus. It's not to create a pale replica of what was, but to create the very best in the environment that we're in for as long as we're in it. And that's why we didn't make this an opening guide. we called it an operations plan. And we're going to keep it in draft because we're going to continually revise it because in a way the world's in draft. You know, as we continue to learn new things and figure things out, we have to remake decisions when it's appropriate to make the best ones because things change so quickly. So getting into it, our priorities lead right up front. And these are pages right out of the guide. I only selected a few just to talk about and to sort of hit some of those high level questions. I do encourage you to go through and read it. It certainly is representative of the months of effort that we've put in. And again, we'll continue revising it. And I hope you find that website helpful. That was linked to the email that went out earlier. So, you know, guided by our values and beliefs, our top priority is to promote, maintain, do everything that we can focus on the health, safety, and well-being of our students, of our staff, and of our community. So in here, we've had to make some hard decisions around things like volunteers coming into the schools. It's something we're so proud of. The public engagement in education here in New Canaan is second to none. It's amazing, and it helps make us even better. But this year, as we go into it, we're not going to be able to open our doors to volunteerism. We're not going to be able to host, you know, PTC meetings and other meetings here in our schools. It's just not part of the plan right now. So that's how we maintain the health, well-being, safety of our folks. It's not an easy decision. All of these are hard decisions, but guided by that first and foremost, we know the right decisions, and those are the ones that we continue to make. Focusing on our instruction, really thinking deeply about the social emotional wellness for our students, supports for our students in that regard. Sorry. Really working hard in that regard, making sure that we have the supports in place for our kids, for our staff, for our families. You know, unlike the closure in March, now as we think about this next year, we have time to do that planning and thinking and to go into the year, you know, sort of with our eyes open and what could be so that we can proactively plan. Again, I'm not going to read to you. You can see these things. So one of the ways that we're planning here, one of the things we're doing is really looking at what we call best practices mitigation strategies. These are the strategies that the CDC, the AAP, the State Department of Education, and others all say are the right strategies to help us to maintain health and well-being here in our schools. So we start with class groups and teams, what we're calling cohorts. And I'll get more specific about West, but the cohorting idea is that we have groups of kids that really stay together with a few adults throughout the course of their day. And then if there are issues that arise, we can identify, isolate, and track in small groups. And so one issue doesn't necessarily knock the whole school off course. We may have to do something with that cohort, but we're still able to, you know, keep schools open if, you know, other mitigating strategies are also in place. Social distancing, you know, we're looking to take spaces that are designed for collaborative learning and create distance in those spaces. That's a challenge, as you can imagine, but we're working on it and we're doing it. As a matter of fact, every day for the last 2 weeks, we've had folks walking the buildings, looking at what furniture should come out, what should we use, how do we do this? And we have some other things that we're going to be implementing as well to help out with that. Some shields in some places and things like that, where, you know, we know that our schools are not places where kids sit and get all day long. They're engaged, they're active, they're involved. So we're working to figure out how can we best do that in our classrooms. Face coverings, masks, and face shields. That we know that that's a powerful mitigating strategy. And we are looking to put a system in place that works best with all of that. Again, this is a layering of strategies. So one strengthens the next. And so with face masks and face coverings, we're looking where might it be appropriate for a face shield to be used instead of a face mask? How do we build in mask breaks? You know, how do we incorporate the outdoors into our instruction to give some opportunities for breaks? What do we do during lunch? You know, when students are sitting at tables eating, you can't wear a mask and eat, which I find often when I forget that I have a mask on and I try to eat something. Or drink my coffee. So we know that, and our kids they'll be in the cafeteria in different ways. So we're figuring all of those things out. And I think we've developed some really high leverage solutions to a lot of these problems. Frequent hand washing seems simple, incredibly powerful as a mitigation strategy. Something that we're working with our teachers and others to make sure that there are opportunities for students to do that throughout the course of the day. And we continue to reinforce it. And of course, the daily monitoring of health and staying home if you feel ill. This is something that we really thought hard about too when we've developed the model I'm about to talk about. The idea that, you know, if students don't feel well or if teachers don't feel well, we really need them to stay home. You know, it may just be for a day. We know in the fall we go into allergy season. We have other things that happen. And, you know, anyone who's been in a kindergarten room knows that any given day, half of them are going to be having the sniffles for some reason or another. We understand that. But if students aren't feeling well, or any of these signs that are listed here, which covers an awful lot, we understand, but we ask for you to stay home for the day until you do feel better. Because it's just, again, another important mitigation strategy that we can put in place. So all of these together, we know that there's not one answer. There's not one big thing that we can do that's going to solve this and defeat the virus. We know it's the cumulative impact of our collective efforts that'll determine how well we do. So we're in this together. We're going to be using these strategies, layering them one up on top of the other as recommended by CDC, DPH, the state, others. And that's a big part of our planning has been around how to do that. So the model that we've been developing and we continue to develop, I mean, in all honesty, this isn't something that we publish, we laminate, we throw it out there and say, here it is. We're working this out, working out the fine details as we continue to learn more. So there are 3 different modalities of instruction as we look at next year. And you'll see the color coding is purposeful, and it's yellow for in-person learning with low spread, orange for hybrid learning with moderate, and red for remote learning with high. And you'll notice there's no green, right? Green would be no community spread, that we are able to go back to where we were back in March before the close. We're all hoping for that. But in our planning, we're being realistic about where we are today, where we're likely to be in the fall, and as we go through the year. And we have to create a model that takes all of those data into account. So the idea is what modality we're in is going to be fact-based. We're going to be working directly with the epidemiologists, the State Department of Health, the local Department of Health, our district medical advisors, others, to make fact-based decisions about where we are as far as community spread. The model needs to be fluid. I'll talk about this in a little bit, but no matter, essentially, as we look at things, whatever model we're in, there's a possibility of running in a hybrid, and I'll explain that in a moment. So we have to set it up so it's fluid so that students can move in and out of a modality based upon their own individual circumstance. Flexible in that, as I mentioned, we're not laminating the plan saying, you know, here it is, but we're saying we're going to continue to develop this and learn. So the in-class experiences, the remote learning, all of those pieces that we'll be talking about, we're going to continue to refine. You know, we believe in continuous improvement, and we're going to be, we'll be putting that to the test in the year ahead. But I'm confident we are well prepared for it. And then fast, that the model has to be able to flip quickly from one to the other. I remain incredibly proud of the fact that when we closed down in the spring, we closed on March 11th, and by March 13th, we were providing distance learning for students. And it evolved over time, but we quickly did that. We were able to do that because of the weeks of preparation that went into our thinking, our work, and what all the teachers were doing and all the staff and everybody to prepare so that when we did close, we were ready. Even in 2-hour delay that we had that Monday before to get supplies out and to get teachers that last chance to plan. All of those things helped us to be able to quickly get into that distance learning mode. And we're using the summer to similarly plan and be ready so that we can move in and out of any of these 3 modalities as the conditions warrant. So we need to be ready. So when we look at what these 3 modalities sort of represent on a low community spread model, we're looking at schools being open, 100% capacity for students and staff, buses running at full capacity, and implementing the mitigation strategies that I talked about earlier. You know, face covering, social distancing, hand washing, you know, staying home if you're ill, all of those things in place as we go through the year. The identification and isolation of sick or ill students or staff is very important as well. So we've identified an isolation room where if somebody is exhibiting symptoms during the course of the school day, we're able to isolate and, you know, get that student to the room prior to pickup by you know, parent or guardian. The cohorting and how important that is, getting right at the start, beginning with cohorting to be sure that if something does occur, we're able to trace it quickly and to contain an issue. So you see that Moderate spread, all of those things are still in place, but we're looking at a half capacity. So we would create the 2 cohorts as we talk about in the guide. A through K would be one cohort, L through Z would be the other cohort. And in that model, the reason we went alphabetically is so families can stay together. So that if if a family has a student at every level and at different schools, whatever, so that those days are similar so they can support one another. So we thought that made the most sense. So you won't necessarily find a class of 20 being split 10 and 10. It might be 13 and 7, but it's on a school-wide basis, we're reducing the capacity to 50%. And then, of course, if we get into the red, which is the high community spread, then we are closing our schools again. We're in 100% remote learning. Our schools would be open to our most vulnerable learners, and we'd look at suspending those extracurricular activities. Okay. So in a low community spread environment where our schools are fully open, we've got to plan out for a couple of different modalities, as we're calling them, because our schools are open and we would encourage everyone to come in. But individual circumstances may drive a family to decide they want to do remote learning in the beginning. And we talk and think about this often. Education in the United States has been compulsory for a long time. So this is really a first time where it becomes this choice between, are you attending it in school, attending it out of school, attending from home or remotely. It really does put a whole host of challenges in front of us, but I think that we've done a good job figuring out those challenges and developing a system that's flexible, because we're going to have some that may opt for the remote learning option, but we may have others who come into school and don't feel well, and we want them to be, or don't feel well enough to attend. I mean, if they're sick, then we wouldn't expect them to be able to keep up necessarily, but feel like they may be getting ill, so they may choose to stay home sick. We want them to be able to log in and still participate where possible, because we don't want them to have to choose between being in school or not being in school. We don't want them to feel they're going to miss out on that instruction, because we know we've got lots of kids who push themselves to come to school when they don't feel well because they don't want to miss anything. So we also may have kids who, because of some other condition, other instance in their family, maybe a family member is sick, tests positive for some reason, they have to quarantine. We may have students who wind up having to quarantine for a period of time, never get sick, and then come back. So those students, we're sort of thinking of them as a hybrid in a way. It's not alternating days, but they're in school for a little while, then they may have to be out for a period of time. We want them to be able to reintegrate quickly back into the classroom. So for all of those reasons and more, in the low community spread, we'll be teaching live face-to-face to the students that come into the class, but also live streaming our classroom home for students who are home to be able to log in to participate from home. We'll be using, a video conferencing software. It'll be a blend of synchronous and asynchronous, sort of a blended learning approach, in that we're not going to have students staring at a screen all day, but they will be on for periods of time and using and following the school schedule when they do this. So they'll be logging in, they'll be checking in with the teacher, they would be participating remotely for craft lessons and for directions and assignments and conversations and things. And then they may log off for a period of time to do some work where students are maybe working on something at their desks. They would be working at home at their desks, and then have them log back in at a certain period of time. To assist with this, we're using what are called learning management systems. So K2, we're using something called Seesaw, grades 3 through 8 Google Classroom. That's an addition we didn't have last year, because in the survey and in the feedback, we really heard from elementary parents what a challenge it was to try to manage and navigate all of this. So we believe the live streaming option plus the integration of the learning management system will make it a very different experience for families and students, and better one. So in a low community spread, again, we encourage everyone to come in, but if for any of their personal reasons that people feel they would like to stay remote and do it from home, that's how that system is being designed. Okay. In a moderate community spread, in this case, we want to reduce, as I said, the capacity. We're going to reduce the participation to 50% in our buildings. So we're looking at an X and a Y cohort, A through K, L through Z, and the cohorts would attend on alternating days. The day that the cohort is home, they're participating in the remote learning. So teachers, again, are live streaming their classes, but now it's not only going out to those who have opted for remote learning, but it's also going out to the students in the opposite cohort from who's in front of them. And that's instruction. Again, we're going to continue teaching through that, because the other option is to do only do the live teaching and teach every other, repeat the lesson every other day, which cuts in half the instructional time for our kids, essentially. So that's not a good option for us. So we're going to be live streaming at home to the cohort Y on day 1. And if students have selected into remote learning, to them as well, while cohort X gets face-to-face instruction. And then on day 2, we flip it, cohort Y comes in, cohort X stays home for the remote learning, and they'll be live streaming that way. In a high community spread environment where our schools are closed for instruction, that's where students would not be coming into class at all, and it would all be remote learning. Teachers may do that from their homes. They may do that from the school in their classrooms. Those options are there. And in all 3 of these options, our most vulnerable learners will be identified and be able to participate in the building in a variety of ways. In a hybrid, they may come in every day instead of every other day, depending upon their support needs. And if schools are closed, it doesn't mean the building is closed entirely. It means that students are not attending in schools, but we may still have some students, again, those vulnerable learners coming in. Again, these are things that we've learned from March, from this closure and shutdown that we had in the spring. The mitigation strategies that we've learned since then help us to keep things safe on a small scale. If we have some teachers coming in to teach from the room, or other students that need to come in for any reason. But at that point, all of our instruction would be provided through distance learning using the learning management software and the video conferencing system that we have. Now, on the first, I mentioned before that all this focus on the first day of school, and it's important, but equally important to the other days. We do want to plan, and we have carefully planned out what the first week could and should look like for our students, and the first 2 weeks for our staff and our students, because it is true that our return to school, whatever it's going to look like, is going to be the first time our kids are in school in the buildings since March. And we recognize that that comes with a host of challenges in a normal year. And there are more challenges here now. So what we're looking to do is, if you look on the onboarding and re-engagement with learning plan, we're looking to bring our faculty back a full week early and learn with them, teach them, and prepare for students. And then beginning on Monday, August 31st, we're bringing in the cohort X, which is kids A through K, but not the cohort Y, which is L through Z. We're bringing in 50% of our kids. And we're doing that so that we can work with them in a half group to teach them the strategies they need to have, the different systems that are in place, the safety needs, everything that we need to do to prepare them to be able to function in the classroom safely and in the building safely. The next day, we do the same with cohort Y, 50%, and then we do it again Wednesday and Thursday. So the idea here is to bring in half the kids for the first 4 days, help them to have the time to learn and practice what they'll need to know. Also create an opportunity where they get to know the teachers a little bit better, and the teacher gets to know them. If we have half the class in front of us for the day, it's a lot easier to connect with those kids, get to know them a little bit more, have them get to know each other than it is with having the entire class there on day 1. So this, we believe, will help us as we reintegrate into the schools, sort of onboarding our kids, knowing that, again, they've been out for as long as they have. On that Friday, on the 5th day, we look forward to having 100% of our kids in. And then doing that on the Friday gives us also the 3-day weekend to problem solve any issues that arise that we're trying to think through everything, but you don't always think of everything. So if anything pops up that we hadn't foreseen, we'll be able to problem solve that over the weekend. Same goes on those first 4 days. As those kids are coming in, we anticipate that more people will be driving their kids to school than before. So we've got to look at traffic patterns in the morning and in the afternoon. What does drop off and pickup look like? How do we move cars through? Each school has its own sort of traffic flow. How do we do that best? So those are some of the challenges we're working through now on paper, and then we'll learn beginning Monday, the 31st, what it actually looks like. Now on those 4 days, we don't anticipate that students who are home would be participating in that live stream. The live stream would start on Friday. We may do something with it, on Wednesday and Thursday on a small scale, and we're still working out those details. But really the time, certainly for Monday and Tuesday, it's an opportunity for our teachers to get to know our kids and the kids that are in the class to get to learn those mitigation strategies and how to move throughout the building, understanding what the cohorts mean and why they're important, what lunch is going to look like. There are lots of things. Operations are going to be different. It's not going to be the way school was before. And we just want to make sure our kids have the opportunity to become comfortable with that and ask the questions that they might have and get to know their teachers and each other and start building that trust from day one. I mentioned the cohorting. So at the elementary level, the cohort unit is the homeroom. So the homeroom becomes the cohort. The group of students stay together throughout the course of the day. Many of our teachers are going to be pushing into the classroom, meaning that instead of traveling to go to their special or traveling different places, the special comes to them. It helps us to maintain the cohort. Of course, we do have different teachers who are moving with the kids or coming in with the kids. That's where all the other strategies become equally important. The social distancing and the mask wearing, with the teachers as they move across different cohorts. But that's the cohort there. And then again, if we have to isolate because of a positive case in a classroom, we look at that class being isolated, but we don't look at the whole school. So we're able to work within that structure. And we saw an instance of that this summer at childcare, where they were cohorting and one of the instructors became ill. They isolated that one cohort, but the other cohorts were still able to function. And this is a strategy that's worked well over in Europe and in places that have opened their schools, similarly to the way we are. The face coverings are also important. We are following the guidelines of the state, the requirements of the state, and expecting all students and staff in the buildings to wear a face mask. We are building in opportunities for students and staff to have mask breaks. I mentioned before, we're looking at how we can use the outdoors. We're also, again, looking at the social distancing and how do we build in those breaks. We're looking at classic barriers where it makes sense to do that. We have our students learn with each other often. They have collaborative groups often. And so we have some clear plastic barriers that we're using to accommodate those kinds of things. So masks are expected for folks in the building, and then the teachers with some training are going to be guiding students for when mask breaks are appropriate and how best to do that. Transportation, we've approached transportation we have essentially two sets of runs. We have a traditional set of transportation runs, and then we've recreated the runs if we have to go to a hybrid to balance out the students that are coming in the cohort X or the cohort Y. It's a little trickier, but we'll communicate that to you in writing down the line a little bit. We will be surveying parents and faculty about the fall next week. As part of that survey, we'll be asking about need for busing. As you know, busing is it's a mandatory provision from districts, right? It's a mandatory accommodation for anybody who needs it. But if folks don't need it, this is a good year to drive your son or daughter to school if you can, because we'll try to bring down the numbers of kids on the buses. The students on the buses will be required to keep their masks on, to sit two to a seat, and to use hand sanitizer coming on the bus and coming off the bus. We do a deep clean of the bus at the end of each day. So as the buses start the day clean, if we have time, as time allows, we'll be cleaning in between. But the transportation, of course, is a challenge, as all things are, because again, just like our schools are not designed for distance, our buses aren't designed for distance either. Those are tight spaces. So we'll be running with the windows down and things like that, those types of strategies to keep things safe. The classes themselves, this is a big question, I think, for a lot of people, and it continues to be a fluid environment with it. When do we cancel classes? When do we go to remote learning? When do we reopen? When do we go to a hybrid? How do we know this? I was on a call last night for a couple of hours with epidemiologists from Yale and UConn Health and others. There were also participating in the conversation members from the DPH, the Environmental Health Division, and other things. And we're looking at the Harvard model. We're looking at Massachusetts. We're looking at New York. And they're working, and this working group that I'm a part of is looking to develop the set of metrics that will be communicated to districts as far as levels of community spread. and looking locally and looking, statewide. And there's some really fascinating science that's being developed around all of this. But as you know, we don't have a lot of time. So we're looking at these other models to see what makes the most sense. If we were to open today, given where we are as a state in Connecticut, we would likely be in yellow. We'd be in a low community spread environment. We have less than 1% testing positive, which is in the green. That's a really good sign. But we do have some, enough positive cases per 100,000. So we'd be in the low community spread if we were to open today. We don't open today, we open in a month. So we have got to wait to see what the data show when we get closer to the opening. Okay. But we will continue to be guided by the CDC and their guidelines on when to open and then how to reopen if you do have to close. Because that's, again, part of what happened in the spring, which we knew as we sort of went through all of this, but we closed with positive cases. And then that date, as you remember, just kept getting pushed out. One of the challenges was it wasn't identified when it was safe to reopen. When did we know that we were at a place that if it's high spread, we have to close? When can we go to a moderate spread? What does that look like? What does a low spread look like so that we can reopen and start to reintegrate back in and onboard back in? We're working this summer to try to get those metrics in place with the health department and others so that we have that heuristic around all of this. The need to quarantine. The CDC guidance around that is right here at the top of the page. And they talk about anyone who's been in close contact with someone who has COVID-19. And you see what counts as close contact. Essentially, the way we describe and think about this is if someone is directly in close contact with someone who has COVID-19, then they have to quarantine. But if someone is in direct contact with someone who is in direct contact, they don't, unless this person tests positive, right? It's sort of once removed, yes, twice removed, no. And so that's what informs the cohort model. So using the cohort model the way that we are and keeping that with fidelity, then we're able to manage if we're so challenged with positive cases in that way. Okay. So the good news again is that in Connecticut, we've seen this downward trend in new cases certainly since our peak, right back in April. The EOC here in New Canaan continues to meet. Now we're meeting weekly. At those meetings, we're reporting out by the town's medical director, who is Dr. Reed, associated with Stanford Hospital, and the Board of Eds, which is Dr. Pierce, who's associated with Norwalk Hospital and the 7-hospital affiliate. So we're able to get quite a bit of information back from them about what's happening. And they continue to give positive reports around number of COVID patients that are in hospitals, what they see happening, what those trends are. All of that is really encouraging. So Connecticut, we're doing well. Nationally, not so well. And so, if we continue here locally to sort of do our part and take care of ourselves and each other, we're hopeful that when we get closer to opening, our metrics stay positive. I think it's for us, we've been certainly comparing ourselves as a state and as a town to those countries in Europe that have successfully done this, and there are strategies that they've employed that we're employing into what our thinking and planning has been here. And again, we'll continue to monitor the external environment and make fact-based decisions along the way. So with that, I'm going to take a breath, stop sharing, and jump over to Dr. Carenti and the team here to see about our Q&As.
So I do believe that you've answered a lot of the questions as you've gone along, Brian, but you do have a question that you might want to consider addressing again. It's really about have we considered about going into shortened days to lessen the time for mask wearing, and how will mask wearing be enforced, and how does that play into recess time and outdoor learning? And
Sure.
Maybe you could talk a little bit about some of the outdoor learning that we've established as well.
Love to. Great. And again, just to remind people, if you have questions, just type them right into the Q&A and we'll curate them through that. This way we can group them together. So it's shortened days. One of the proposals that's before the Board of Education for consideration is looking at our weeks and looking at Wednesdays and doing half-day Wednesdays. What that would do is give us an opportunity to provide professional learning for our staff in the afternoons. It would also give us an opportunity to get our custodians into the cafeteria and other spaces and really do an even more thorough cleaning right in the middle of the week. and it would give an opportunity, again, for those purposes around mask wearing a little bit and what have you. We're not shortening the days themselves. We're running on a similar schedule to what we've had. And it's important to do that, in part because, you know, we do have requirements under the state Board of Ed and state regulations around the number of days and the number of hours that we provide instruction for our kids. Of course, we also think that, you know, we want our kids in class. We want our kids with us. It's important, though, you know, obviously. But the having a half-day Wednesday could be very helpful, I think, for a variety of reasons. We likely may not even offer lunch on those days, you know, so it would be an opportunity for us to get in and to, again, do that deeper cleaning a bit. As far as the outdoor spaces go, and I want to really give credit to Jan and Ashley as well, right from the start, when we started talking about this, we looked around the campus over at West and said, you know, what areas can we use? We've got beautiful courtyards, and thanks to the PTC, we've got one that's really looking wonderful, that they all do, but really designed for, you know, instructional space. And lots of other areas on the grounds. So I know both Jan and Ashley have done some work even thinking about, you know, how can we identify spaces outside and make sure that they're available for teachers to be able to take their classes out there. In order to do that, of course, we've got to make sure that our Wi-Fi is robust enough out there for the technology needs that we have and other things. And we're also talking about what does security look like, you know, to be sure that we have enough supervision around the outside of the building while our kids are out there with their teachers. So we're working on those details, but we do think that going outside does give an opportunity for mask break, but we want it to also be instructional time. We want our teachers to be able to use that time. In the past, we might have taken a class outside just to take a break, but now we want to be able to take them outside and you know, with instruction. Now, as far as recess goes, again, that's where the cohorting becomes so important. We're looking at different areas around outside, keeping cohorts together. And if, you know, using hand sanitizer before and after, the working to, you know, we're looking to see, can we wipe things down? It's challenging. You know, we've got so many different classes of kids and only so much equipment to use. So we're working through what that may look like as far as schedules go. But keeping the cohort together means that they can have more opportunities for mask breaks because, again, it works as a unit that way. So those two strategies complement each other.
There are a lot of questions in regards to school closures and which guidelines is it going to be decided by the state of Connecticut, will it be decided by New Canaan, and what's the thresholds, and will just one cohort go out, will the whole school have to go out, how does that impact if I have a child over at Saks? So I know you talked a little bit about the closures, but maybe talk a little bit where the state might be in regards to all of that.
Sure. So last night at the governor's press conference, he talked about flexibility. And prior to that, so yesterday at 11, me and 8 other superintendents from the region, we met with Governor Lamont over at New Canaan High School in the Wagner Room and had a conversation. He joked afterwards, he thinks he heard the word flexibility 100 times in the conversation. So he mentioned it last night at his press conference. And the idea there is that, look, they're going to provide us with guidelines, but ultimately the districts will have the flexibility to make the decision that's right for them based on their metrics, their Board of Ed, their local health department, and what's right, you know, for that town. So we will ultimately be making the decision locally. We do hope and anticipate that we'll have some guardrails, they're calling them, that come from the DPH and through the Yale and other state epidemiologists. So when it would happen, we're still figuring that out. You know, sort of what does low community spread mean? It doesn't mean none. So where's that threshold? What does it mean? And what metrics do you use to identify that? I do think that the metrics they were talking about last night were the % positive in testing, which right now Connecticut is very good in. We're below 1%. And the number of cases per 100,000 is another important metric that continues to be mentioned. There are many others that make it very complex to develop a model, but those two seem to be powerful drivers in decision-making around this. There's talk of a regional approach. So, you know, we're in Connecticut District Health Region 1, DEMS, and there's talk of a regional, whether it's that or like the Southern Fairfield County group or others, trying to move regionally one way or the other. Not sure if that's going to be the course that the governor and the commissioner decide to take. They're still really talking that through to try to figure it out. But again, I anticipate they'll have the high level info, and then we'll take it a step deeper to go into, so what happens if there's a positive case in a classroom? And I would anticipate if it's over at West, again, we may have to isolate or quarantine one class, one cohort, but the others may be able to continue. And if there's a sibling, let's say, who's over at Saks, then that sibling may have to quarantine, but not the rest of the class, because remember, then they'd be 2 removed from the positive case. And it's just 1 removed from the positive case under CDC guidelines that gets quarantined. Okay, so really those guidelines can always change. So I can only tell you what they are right now, but that seems like a logical and reasonable approach to decision-making as we consider what could happen with cases. Did I cover all aspects of that question,
I
Joe?
think you have. And certainly if you're seeing that your question hasn't been answered, by all means, you can type it in again. There's a few questions here about kindergarten, and I'm happy to take those if you want to take a breath, Brian, because the next category will be on ventilation and air purifiers and keeping windows open. So if you want to start in on that, I can certainly take talk a little bit about kindergarten. So certainly, as the past tradition has always been, that first day for kindergartners is shortened, and it's an orientation for parents and students. Unfortunately, that parent orientation piece will need to be postponed because we can't be bringing parents into the buildings. So the first day for kindergartners will be Monday, August 31st, and it will only be half the cohort. And to answer the cohorting question, if you do have a last name that begins with A through K, you are considered part of cohort X. And if you are L through Z, you are part of cohort Y. And so we'll only be half of the kindergarten class on Monday. There's no remote learning for those first 4 days of school. We may try to do something for Wednesday and Thursday to try some things out, but certainly for Monday and Tuesday, if you've been assigned to cohort X, you'll come to school on that Monday, but there will be no remote learning for Y. And then on Tuesday will be an opportunity for Y to come to school, and the cohort X would remain home. And this will really give us an opportunity to train kids and give them that opportunity to get around the building a little bit better with their cohort of kids. And the cohort is the classroom. That's how we're defining it. It's that homeroom. So if you've been assigned to one kindergarten class or one first grade class, that's your cohort. And then obviously there were some questions that came in about online learning, and we're always taking that into consideration. And we're always watching how much time kids are online. And certainly if we're in full school, then there's less time that they're going to be online because they're going to be doing their instruction with books and paper and all of those utensils that they normally would use in school. If they move to a hybrid, the live instruction will be consistent to what the kids at school are getting. So there's no separate curriculum, it's the same curriculum. So if I'm teaching a reading lesson and Jan is at school, she's watching me. But the people that are at home are watching my reading instruction lesson through their computer. And then they might take a break from the computer to go off and do some independent reading or an activity, but then ask to come back onto the computer. So we're working through all of that. So I think I could switch back over to you, Brian, to hit about ventilation, and then I'll start scrolling for another category.
Great, thanks, Joe. So ventilation, we've been looking at this for months now because as you know, the research as it's been evolving has said that how important this is. In our buildings, for the most part, in the classrooms over at West, we have unit vents, right? So they're the wall units that are in there that really do a good job of recirculating the air and filtering the air, but they really don't do a great job with the air exchanges, fresh air coming in. So we're looking at how best to solve that. It's really a combination of fresh air, but also controlling for humidity a little bit, because we have to be careful around outdoor humidity coming in. And we're looking at solutions that could exhaust in the rooms. You know, if we can figure out a way to create, we believe we have a solution we're ready to go to scale on, to create a very low level negative air pressure in the classrooms that will draw out and exhaust the air that's in the classrooms, because we can't just open a window, which would allow all of that humidity to come in, which could become problematic down the line. So that's really the solution, has been that. We have some air conditioning units in some areas. You know, we've got RTUs, they call them, rooftop units, over the office of the library, over the gym. I believe cafeteria as well. I have to double check that. But we have those units as well. Those would be running and exhausting, and also conditioning the air and controlling for some humidity. That would be with those doors open. If there's a negative pressure in the classroom, that's where it would be pulling the conditioned air from as well, which will help to keep the classrooms comfortable for the kids. So that's what we're looking at for ventilation. Each building's a little bit different there, but like the other elementaries, the unit vents, the individual units underneath each of the windows in the classrooms is the most common HVAC system in the room. So that's where we have to go with some kind of a fan or some kind of a circulation solution that we're looking at specific models now.
Great. I think there's some questions about school supplies and the managing of school supplies and sharing of materials.
Sure. Another thing we've been working on for months. So we are we're really encouraging students not to share materials really at all. We're going to be issuing devices per student that they'll use. They won't be sharing devices. That doesn't mean they'll be carrying them back and forth from home each day in the younger grades, but they'll be using the one that was assigned to them. We've gotten cubbies for each student that will be installed where they can come in, they can put their things in the cubby, and that's how they'll manage their materials. As a matter of fact, I think the cubbies might even be like, you can lift up the bin and put it right in front of them, and they can use the materials out of there. And then at the end of the day, put the bin back. So the art supplies, we're purchasing art supplies so students can more individualize that, not share. So we're really looking closely at shared materials and reducing or eliminating shared materials wherever we can, but also remembering that the washing of hands throughout the day, using hand sanitizer. We're getting large sanitation stations for every building, similar to what you might see in an airport, where when you walk into the building, there might be 6 or 8 different stations in one large unit where you can put your hands under to get the sanitizer and come in. We'll be teaching the students to be cleaning their hands, not to be touching their eyes or their face throughout the day. So all of those strategies all layer on top of each other, as I mentioned before, but we're taking a close look at material sharing and reducing or eliminating it everywhere we can.
And Brian, just to piggyback off there was a question in regards to devices. So students in grades K through 2 will be getting an iPad, and students in grades 3 and 4 will be getting a Chromebook. And there will be a lot of training that will be going on with the students at school on how to care for those devices and take care of those devices. And they probably, for the most part, will be kept at school unless we need to move into hybrid or remote, or somebody is doing an online experience. I would imagine in grades 3 and 4 that those Chromebooks would be going home with kids a little bit more frequently to possibly complete a written assignment. But that would all be part of the easing back into school and teaching kids how to utilize those devices, care for those devices, how to access Seesaw and all of that. A couple questions about health check-ins, like will temperatures be taken? Will there be a health questionnaire that parents need to answer every day?
Sure. So the state has really moved away from this idea of temperature checks on the way in. And there's a couple of reasons for it. Primarily, it's just the reliability. I mean, temperature is variable. You could have a student on a hot day who's wearing an extra layer or whatever, and their temperature could be up or down. In the morning, our temperature tends to be lower, turns out, than it does in the afternoon. I mean, there's lots of variability with that. And there's always been a question of, is it truly an indicator of this? And it's certainly not an asymptomatic indicator, right? If it is at all, it's a symptomatic indicator, in which case, there's the issues of earlier. So we're asking families to perform self-checks with their students and staff as well. For instance, I've been using the How We Feel app just about every day that the state has put out. Just to keep track, and I just enter that in, and it just asks, how I'm feeling and what have you. We have a Google form that we've been using throughout the summer for our camps. The few camps that we've run, we've done that with success, but we really can't go to scale on that. So we're going to be asking families to be checking themselves, checking their students, and making the right decision, and doing an awful lot of training and providing resources so people understand what that means and the importance and why to do it. But again, the state and the guidelines and DPH and others have really moved away from temperature checking. Another important reason why we're not temperature checking is the queuing of students waiting to be checked for their temperature would be, it would essentially eliminate the cohorting model. Social distancing would be really hard. it would take a significant amount of time to move the kids in that way. But that's not the primary reason. The primary reason really is it's not a truly valid measure, according to the doctors and the epidemiologists and others.
There's some questions here about if parents choose to hire a teacher for a group of students outside of school, will they be able to utilize the WES curriculum? And I think that's really more of a question about homeschooling. So if you're choosing
Right.
not to send your child to school and you're going to be withdrawing them from the public school, then you'd be following homeschool guidelines. And when you do homeschooling, it's really up to the parent's responsibility to provide curriculum and provide what they need for their kids. So what's available online, kids might be able to access. They wouldn't be able to access all of our websites because you have to have an NCPS domain to access many of those websites. But as far as the learning activities, but that was just a question in regards to curriculum. There are some questions about after-school activities, like will after-school activities run, and what happens with the cohorts with after-school activities, and can families pick the cohorts they want to be with based on those after-school activities?
Sure. So after-school activities are tricky. We're going to be looking at them at a case-by-case basis. Picking, that's the challenge is maintaining the cohorts. But for our scheduling purposes, we have to schedule in the ways that we have traditionally because of the fidelity of that model, and because there are lots of things that go into that scheduling. So we can't regroup students in their classroom based on an after-school activity. It can't really work that way. So we are looking at those activities to see what will work and what makes the most sense to run. We'll be working with Bill Cap and others who offer those programs. We are also going to be asking families to do what they can to try to maintain the cohort outside of school. And if they can't, to really be a little extra aware of social distancing and mask wearing and other things, because again, it's one strategy, but other strategies all help to strengthen it. So, but as far as after school activities go, we have to look at them individually, one at a time, see what the activities would be, and make a decision around what's appropriate and what's not. And there's somebody has a hand raised. I only want to ask that person who raised their hand to use the Q&A to ask the question instead. Go ahead.
Some great questions here about training parents on the different platforms. So certainly that's a great idea and something that we can certainly take into consideration to train parents whose students will be using Seesaw in K2, and certainly in grades 3 through 8 with Google Classroom. We'd be happy to work through that so that parents know how to access and how to communicate with their teachers. Let's see, there's a question about the professional development days and will they be consistent across all schools? And I think you talked about Wednesdays, and that would be consistent for all the schools this year.
Right. This past year, we changed. It was one day for the elementary, another day for the middle school. This year, we've decided that it works best to do Wednesday across the board for everybody, so that we can train across the district in some of the similar tools and things. Regardless of grade level, there'll be lots of similar training that can occur. So it makes the most sense. And again, we think it hopefully is best for families to do it that way.
Jan, there's a question about the EduKits. Is that something that the PTC offered in the springtime? Will they be able to purchase those? Has those purchases already been processed?
About the school supplies?
Yes.
Yeah, for most new families, we've been sending them the link directly so that they can order those, and those can be ordered all the way up through the beginning of the school year. So for the most part, I think Laura, who is our registrar, she usually lets us know when we have a new student, and we send them a link so they can purchase the supplies. They can also bring them, we have a list, they can bring them from home if they want.
Great. Bill, there's a couple questions in regards to special education, in regards to speech therapy, and how they might be grouped. And if they are considered a vulnerable population that might be able to come to school more frequently.
Yeah, so certainly students with IEPs would be considered, depending on the level of need, to be able to come to school 5 days a week if we go into a hybrid model. It would depend on the level of services and needs of the student, though. And then in terms of, there was a question there about special ed and speech and language and pulling students from different classes. We're going to try and stay with the cohort as much as possible, but when we have to pull across the different cohorts. You know, we're going to look to using another level with that social distancing. We're going to try to increase the social distancing when we bring kids together for those therapy sessions. During that time, they'll have an increase in distance between the students. We'll look for some larger rooms and spaces throughout the school to be able to use for those, you know, situations.
There's a couple questions that are coming in on distance learning. And it's probably because they're still imagining the distance learning to look a lot like it may have looked in March to June. So we're in the process of revising our distance learning program. So if we do have to go to a full remote type of environment, we will be doing more synchronous instruction, and where teachers and students will be following their schedule for the day. And so that's where it helps to make it flexible and fluid, like Dr. Lutzy was speaking about, because if they might be in a hybrid and they're used to doing that live stream, if you move into a full remote, you're still going to have access to that live stream. So you still will be getting that instruction from the teacher. They'll be asking you then go off and do some independent work, but maybe they're still meeting with a small group of kids. They're going to try to do as much as possible to mirror what that classroom would be like, so that if you come back to a hybrid, it makes it that fluid and flexibility for the students. Brian, there's a couple questions about the X and Y splits across the district. And why we chose the A through K versus the L through and the L through Z.
Sure. Just very simply, it's to help families. You know, we looked at our total numbers. We said, where's the halfway point across the board? Where does it make sense to make this split? And A through K was about 50%, and L through Z was about 50%. You know, it's, I thought it would have been A through L, as a, you know, my last name is Lutzy, and usually I'm in the A through L group, but for us, our numbers were a little different. And then what we did was redesign our bus routes to balance those out, to make sure that, you know, the bus capacities were as low as they could be. Because again, and we're going to be surveying folks to ask them about transportation, about participation, but also have to design a system that's flexible enough that, you know, anyone who needs a bus to take them to school, we need to provide that for them. You know, that's a mandatory accommodation. If someone says on day one they're going to be remote, but then the next day they want to come in, it may take us a little time to process, but, you know, our doors are open. We want students to be able to come in. So that flexibility in the system has to be there. But that's the AKLZ, was to keep families together. So again, it may be a little off balance to any one classroom, but at a school level and a district level, it should be about 50-50.
Brian, there were a couple questions I saw going through around, you know, face mask versus the shield. When can I use one or the other? Is one in place of the other? And then there were also a couple questions you could tie into maybe with the bathroom usage and monitoring that and how we're going to handle that.
Sure. So on the face mask versus face shields, you know, this is an evolving environment that we're in. We're still learning a lot about the difference between mask and shields. As a matter of fact, there was just a study out of Switzerland the other day. Our hope is we're going to be incorporating both somehow. We're trying to figure out what's the best way to do it. I don't think you can wear a shield all day. That's not what the research is saying right now. The research is saying that a mask is better protection, is better for the person wearing it and the other people around him or her. So masks have to be primary, and then what role face shields can play is what we're figuring out based on the science. In the bathrooms, that's where some of those enhanced cleaning protocols kick in. We traditionally would clean the bathrooms each night, you know, go through and do a thorough cleaning. Now we're looking at doing it a couple of times a day while students are still there, and then again at the end of the day. So that's we'll be cleaning them much more frequently. We have disabled the hand dryers that we just so proudly and recently installed across the district. So we'll be disabling those. And fortunately, we kept all of the paper towel dispensers for some reason. So we're installing those back on the walls. We just don't like having to put new holes in, but we'll do what we have to do. And so we're going back to paper towels and garbage cans and what have you. We're going to be managing the bathroom access by identifying sort of which classrooms should use which bathrooms and keeping to that, and asking teachers to really be aware of how many kids are out of the room at any, you know, given time using the restroom or what have you. So we'll manage the flow in and out of the bathrooms. We'll be looking at, you know, closing alternate stalls to keep the distance there, and the same with the faucets, and cleaning them more often.
There's a question about music and PE. So it's a great question about the singing. So we are in the process of looking at our music program, and our teachers are well prepared to move forward with a robust music program that won't involve singing. So there's a lot of different activities that they already have planned. They'll be going to the classrooms to deliver the music instruction, and they've been working hard on that throughout the summer. As far as PE, we're going to be trying to take them outside as much as possible. And when we hit possibly rainy days or really cold weather and they need to be in the classroom, there's certainly some mindfulness and yoga activities that they can do. But there's also an opportunity, we'll be having the PE teachers actually delivering our health curriculum. So they'll be able to look at those health lessons and kind of move through those through the various grade levels on kind of those rainy days within the classrooms as well. This is a great question, and I think we missed when we talked about the cohort X and Y. It just will alternate days. So it might look like X is Monday, Wednesday, Friday, 1 week, but then the following week, cohort X would be on a Tuesday, Thursday. So if we were in full hybrid and we were going over weeks, it would just be alternating days. So 1 week is 3 days, and then the next week is 2 days.
Right, and that's where, I'm sorry, thank you, Jill, for that clarification. And so one cohort on a 5-day week would have 2.5 days of instruction, of live instruction, while the other had 2 days of live instruction, face-to-face. And then the next week it would switch. So it's 2.5 days face-to-face for one cohort and 2 days face-to-face for the other. I don't want to use live instruction.
A lot of great questions here about the first couple days of school and the transition in, and where will kids be able to meet their teachers and how will they know where to get to those classrooms. So as Jan and Ashley maybe work through some of that details, they can certainly communicate those out to the parents, but how do they meet the teacher? How do they know how to get to the classroom and move forward in all of those?
Especially for kindergarten and new to West students. So we're in the process of putting something together, specifics just for those two groups, kids coming in from kindergarten, for kindergarten, and kids who are new to West. So we will be in touch. We're still trying to work out the details for all of those. Yeah.
There's a question, Brian, I'm not sure if you want to address about cleaning products.
Sure. So the state asks for us to use green cleaning products. We do that, but they have, I believe, sort of widened the definition of what that is. So we're able to use cleaning products that do the job that we need done. Okay.
There's a couple questions about childcare for working parents, and we may have to just try to communicate off with our town resources, and once they know what our schedule might be, it would probably be a great place for us to connect with our town resources and see if there's any possibility in regards to helping parents with childcare issues. Trying to just go through, I think we've captured a good majority of them. There may be a few that we've missed.
I know there's a question about teacher assignments. Those will pretty
Yes.
much be as they were in the past. So you'll get an email from each of the schools with your child's classroom teacher and a letter from the teacher as well. Those typically go out more toward the end of August. Yeah.
And the reason they do go out at the end of August is because we're still tracking enrollment. So, and we're very careful about trying to stick within our Board of Education guidelines. And if we need to open up another section at a particular grade level, then we'll do so. We've already opened up some new sections over at East and at South, and right now we're looking closely at another grade level at West. So it's an ongoing process that we follow throughout the summer, and that's why we don't normally release those class placements until August.
It's one of those good problems, right? We've got folks who keep wanting to move into town and send their kids to our schools. So we are working hard to make sure we adjust as those numbers change. Yep. Well, I think being that we are about 10 after 2 or so, I just want to thank all of the panelists here for being here and participating, and especially you, Dr. Correnti. Thank you for working through the questions a bit and helping to organize all that. And certainly to all of our parents, thank you for being here with us today. We know there's a lot of information here, and there are many, many more questions than answers, but I hope that you see the earnestness with which we are approaching all of this. We tell you what we know. We're just upfront with all of it, and we'll keep using the website that you have the link to. That will be our communication tool mechanism for us, so that we can get information out to you regularly through that. And when the time comes, we'll schedule another opportunity to chat. So there's lots going on. It feels like it's tomorrow. We still have over a month. As we've learned in this pandemic, things can change quickly. We're watching it every day. We're adjusting as need be, and we're communicating those adjustments to you. So come back to the website often. Thank you for being here. Thank you for your great questions. And stay cool. I guess the heat wave continues. So stay cool if you're here in New Canaan. So, thanks.
Thank you.
Thank you.